Hello, this is Amanda Brummitt with the Working Well and Coppell Committee at the Coppell Chamber of Commerce. I'm here today with Dr. Brad Smith, an orthopedic surgeon that is fellowship trained in sports medicine. Thanks for being here today, Dr. Smith.
Thanks for having me.
Absolutely. So we're going to talk a little bit about what's going on with coronavirus related to orthopedic surgery and whether or not it's safe to see an orthopedic surgeon. But I want to first start with saying that Dr. Smith recently moved here from New York. And so Dr. Smith, I just wanted to see, is there anything that you can share with us briefly about that experience there before we dive into orthopedic specific information?
Yeah, so I was in New York City for my one-year fellowship. Not quite the one-year experience I expected, but it was pretty surreal living through that, seeing a city that usually just, there are people on every street corner. There's a ton of people, and it was almost empty. It was a ghost town. It was just it was an incredible experience to see how people just responded. When they knew what was happening, everyone just kind of got on board, and especially at the hospitals, people were supporting healthcare workers. Local businesses were helping. Were bringing lunch for people, and it was, it was great to see everyone come together. But also just it was a scary experience because no one at that time, no one knew a lot about the virus and how it was going to act and how fast it was really spreading. And there was a lot of uncertainty at the time. So it was, definitely a very unique experience. Yeah.
Yeah. Well, and welcome to Texas.
Yeah, glad to be here.
Yeah, our experience has been very different than New York City. So it also makes me really curious to hear your perspective on some of the questions, especially related to seeing an orthopedic surgeon. So I'm going to just dive right in with, is it safe to see an orthopedic surgeon right now? If something happens to somebody, should they stay home or should they go see the orthopedist?
So now, especially now that we kind of understand how the virus spreads and ways to protect against it, I think that it is safe to come see an orthopedic surgeon. Here at Precision Orthopedics and Sports Medicine, we're taking all the necessary precautions. We're screening patients as they come in with screening questions, checking temperatures. Everyone is required to wear a mask inside the building, and all the patient rooms are thoroughly cleaned between each visit to ensure that that the table's cleaned and everything like that. There's plenty of hand sanitizer, as there normally is. It's every doctor's office I've been in has plenty of hand sanitizer around, and there's no exception here. And I think it's important to continue to get the appropriate care. If you have an injury, I think it's important to get the care you need and get it evaluated and treated. And in some instances, if you're concerned about coming to the office, we do offer telemedicine visits.
Okay, great. I would think for most orthopedic conditions, it's going to make the most sense to be there in person so you can touch it and feel it and ask questions and do x-rays or imaging if needed. But that's really good to know that telemedicine is an option.
Yeah.
Yeah, especially for follow-ups and things like that. I'm sure it could really make a lot of sense.
Yeah, as you mentioned, it's a little new for, it's a little different for the orthopedic surgeons to, get used to. But it's certainly useful as a, potentially at least as a screening tool to see, figure out what body parts are hurting and what kind of symptoms you're having. And then we can let you know, okay, well, it's, it seems like it might not be that serious, or no, it's worth coming in and getting x-rays and getting it checked out to see if, there's something more going on.
Okay. And then what about having surgery? Is it safe? And if you could give us a little bit of a lesson, I don't know that the general public realizes just how seriously orthopedic surgeons take infection control. So can you kind of walk us through what normally happens in orthopedic surgery in the OR, and then any added precautions during a pandemic, and in general, whether or not it's safe to have surgery?
Sure. So, I mean, normally orthopedics is probably one of the areas where sterility is, very regarded very seriously. And the reason is a lot of our surgeries we're putting in, for lack of a better term, we're putting in foreign implants, foreign bodies in, and whether that's if you have a broken bone and we're putting plate and screws, if you're getting a total joint replacement, that's metal going into your body, numerous other things. And the issue is if something goes in and it's contaminated, that your body usually has a hard time fighting off that infection, and it can result in significant problems and complications with the surgery. So we take sterility very seriously, and that goes from scrubbing into surgery. We thoroughly wash our hands with usually some sort of alcohol or other based scrub, and then we use sterile gloves, sterile gowns. All the instruments that we use are thoroughly sterilized, and they're checked afterwards to make sure there are no holes in the containers that we're holding them, and as well to make sure that they reach the appropriate temperatures and cleaning conditions to make sure that it's completely sterile. So it's very thorough, even in normal times. From my experience in New York City, as things started to open back up with elective surgeries, the additional precautions that we made were very similar to things we're doing here in the office, and that was ask appropriate screening questions, make sure, if patients had any recent travel that was to a more high risk area, that would have them go for further screening, whether that's testing, coronavirus testing or something like that. And we've continued to do that here as far as, monitor for high risk patients and to ensure that there's safety for everyone involved, both the patient and for the staff. Anecdotally, at the surgery center in New York City, where we were getting back up and running, none of the staff there, while I was there in the remaining 3 months of my fellowship, no one tested positive from working there. So seems like the precautions that we did, they seem to work pretty well. And I think what that says is that when everything is followed, things are reasonably safe.
Yeah, I think that's really, really great advice. I feel like the universal protocols in a surgery center or a hospital are pretty darn good on a normal day. Yeah, very, very good. So can you talk a little bit about any orthopedic conditions or signs and symptoms that are particularly important not to wait, not to delay, and go ahead and be seen?
Yeah, I think it's, any time when you have an injury that, a lot of times I know people will hurt themselves and think, oh, it'll go away in a day or two, and it doesn't. So if you have that injury that, you hurt your hand or you hurt your wrist, hurt your knee from a fall or injury, and it's still there in a few days, it's worth getting checked out, because some of those injuries, for example, if you have a fracture in your hand or wrist, any broken bone, and if it's something that would benefit from surgical treatment, the longer you wait, the harder that surgery is. So it's worth coming in and getting x-rays, just taking a look. And even if it's, hopefully it doesn't require surgery, but if it does, then at least and you can get it taken care of. I would say that any injury you have where you have any kind of mechanical symptoms, and when I say that, I mean weakness or any popping, clicking, grinding, anything like that, anything unusual when you move that, the injured extremity, again, I think it's worth getting checked out, because some of those injuries, the longer you wait, again, it can make the surgery more complicated and can make the outcomes less optimal.
Okay, that is really, really helpful. Okay, so I'm hearing that, yes, it's generally safe to see an orthopedic surgeon. It is absolutely safe to have surgery if everybody follows all the protocols that they should. And that if you've got any clicking, pain, in any general orthopedic symptoms that last more than a day or two, to go ahead and get checked out either by your primary care physician or a orthopedic surgeon.
Yeah, absolutely. And and sometimes a small thing can be worse than you think. And just anecdotal example again, there was in residency, one of the trauma surgeons, his son hit his hand during swimming, and the surgeon didn't think much of it, but his son kept complaining. He came in and he had a broken hand, and again, it seemed like a nothing injury, and if he hadn't come in and get X-rays, wouldn't have known right away, and his treatment would have been delayed. So I think it's important to just be aware of your injuries, be aware of your body, and come to get checked out if something's not acting the way you expect.
Okay, awesome. Well, thank you. That's really, really helpful. Thank you for sharing that information about orthopedics and a little bit about your experience in New York during the peak of coronavirus. And thank you for your time.
Thanks for having me.